Hello, Lynn. Thank you so much for joining PTC Punjabi once again.
Oh, thank you so much for having me.
Lynn, as we know that since months, we have been hearing that Canadians are experiencing mental health difficulties due to a global pandemic. Can you tell us, first of all, that what exactly is mental health?
So, mental health, the way I kind of describe it to the people that I interact or talk with is that I kind of describe mental health as thinking about how the body and mind are connected. Unfortunately, you are correct. What we're finding, especially coming through into the second wave, we don't have the data yet collected on the impact of mental health, but I can tell you as a mental health child and family therapist, it has magnified the already existing mental health issues that people have. And now what we're finding is that we're having people that, maybe beforehand didn't have any signs or symptoms of any mental health issues, but now have been impacted.
I would like to mention here that recently there was a survey done by Association for Canadian Studies, and as per the survey, 1 in 4 Canadians say that their mental health is worse than during the first COVID-19 wave.
Absolutely. So we kind of got to go back in history. And the one thing that we have to remember is that history has taught us a lot. And we are still collecting the new data now that's happened since COVID has started here in Canada. But what we do know about history is if we look at SARS, that was in 2003 in Canada, we know that the data collected from that time shared and told us a story. And that story was that people's moods changed. People were, you would find like, and I'm hearing it now in the conversations I'm having that people's moods are fluctuating like a roller coaster. One day they feel good. One day they feel like they don't want to get out of bed and get dressed and showered. Sleep issues. We're finding that a lot of people are not only struggling with getting full 7 to 8 hours of sleep, but the kids now are reversing their whole sleep pattern and that they're sleeping mostly through the day and staying up into the night. And I would say that I lived through both. And I would say that it is more impactful now because we are kind of going into an era like this started coming in February, like how many months we've been involved in this. And we know that we're going through that second wave and people are exhausted.
Absolutely, absolutely. And even in the survey, they mentioned that their biggest source of anxiety is the length and severity of the pandemic. Lynn, I know that you provide counseling sessions. So I would like to ask you here that what kind of counseling sessions do you provide to the people so that, people do not miss that positive energy that they used to get before the pandemic?
At a North York Family Health Clinic, which is umbrellaed with the doctors within that community at North York General Hospital. And I also have a private practice. And so what I'm doing right now is I'm actually talking to a lot of parents, and the messaging I'm talking to them about is how and to watch for what signs. So I've been telling parents that the first thing they need to do and the community around is go with your gut. Your gut is always right. So when you're observing your children and you see like their behavior has changed a bit or they're a bit moody, that they really need to start thinking about addressing that. So whether or not you address it within the family content or whether or not you go out into the community and look for resources, whether they're public funded or private funded. And I seem to sit in both places, and but the issues are the same. Now we are bringing our children back because we know that the impact on their mental health is so important. So the first thing I do is talk about all the other areas of their life. Are you sleeping? Are you eating well? Are you connecting with loved ones? Are you seeking supports when you need them? Isolation has such a huge impact on our mental health. So lately, even in the last couple of weeks, I'm getting a lot of calls from parents saying, I don't want to break these rules and I'm staying within my bubble, but my children are lonely and they need that face to face. And fortunately or unfortunately, video gaming has taken over how children are interacting right now. So when I talk to children and they discuss with me that they're playing 4 to 7 hours a day because that's the only way they can communicate with friends.
Yeah, yeah.
We need to find a better balance. So it's all about life balance in every area of our domains, making sure that, we're not going to one extreme to another.
Absolutely. Lynn, I don't have the exact data right now about how many people, how many Canadians experience mental health difficulties annually. But do you think that access to the mental health services is a growing problem in Canada now?
Well, we know that 1 in 4 children experience some type of mental health issue in Canada, and this is before we ever had anything considered this pandemic or the COVID. So now, what I'm seeing in the mental health field, that children who already had mental health issues prior to the pandemic has intensified. So things like anxiety, where children would have like the upset stomach and crying, not wanting to go to school, now has magnified into more intense anxiety concerns and issues, and as well as depression. I'm seeing that. But what we do know now is that not only is that worsening today in the second wave, we're having families, adults, and children who had never experienced mental health issues before that now are. But that's kind of an obvious one too, because what we do know is that stress impacts our mental health. And when you think about sitting there every day wondering if you have a job, if you still can keep your home, can you feed your children, what's going to happen tomorrow, there's no control over what happens in the next couple of months. And that worries people. And when we add that stress onto people, we end up with more mental health issues. We know right now that the impact has 50% worsened mental health. 50%. We do have that data now. Substance use is on the rise, and anxiety. We don't have the data yet for anxiety and depression. We're still collecting that because we're in it right now, but we know that it's magnified. We can see it as mental health workers. In fact, bigger discussions are happening with mental health workers talking about how we need to start doing some self-care and looking after ourselves and going after resources to help manage supporting our communities.
Do you think this has become much bigger than just a visit to a doctor?
Well, I think it can start there. I think you made a great point. If you are a parent or you're a caregiver or you're the neighbor that's helping that family out, if you see those signs that your child or your family friend or your aunt, any person has some shifting in moods, check in with them. How are you doing? Kind of getting an idea of what's happening for them. And what I say to parents is talk to your children. If you see a change in behavior, whether it's their grades, whether it's their moods, check in with them. And if they say, yeah, I'm not doing good, go to your family doctor, because if you don't know what resources are available in your community for mental health resources, your family doctor will. And a lot where I work at the Family Fit, which I love, they actually have a case manager. So we have a case manager that when you call in, if you're just looking for resources in the community, that person will help guide you. My other suggestion to people that I'm absolutely in love with is called the Big White Wall. It is a free service. It's a website. Kids and adults can go in and have conversations with other people feeling the same way. And you can also get professional help, but you self-guide that. So that is another area that is available for people. There's also what I love together. If you look up the website, Wellness Together Canada, it actually is focused right now on helping support families and children with COVID, experiencing COVID symptoms and mental health issues.
All right. My last question to you is, as I mentioned earlier as well, that people are missing that positive energy, which they used to get from family and friends. So what do you think, what are some of the home activities which kids can do at their house, which will help them to rekindle that positive energy, bring back that positive energy?
That's a great question. And I wish I could tell you that this was my doing and my thought process, but this is what I'm getting from the kids, which is incredible. So the kids are doing a lot of the TikTok is alive and well with all the kids and families. So we're having a lot of families spending time together and creating dances and songs and putting them online. But a lot of the other kids are telling me too that they're doing some really great creative things. It's like we've gone back to the basics when I remember when I was a little girl, when now except for they're using Zoom and House Party to connect with their friends on virtual. And they're actually having like baking parties and organizing craft days. I also worked with a mom who organized in her community, knowing that Halloween, we actually live what's considered the red zone or the hot zone. So we've been advised not to have Halloween. And a mom in the community actually organized all the parents in the houses that wanted to trick or treat and organized a time limit when certain families and houses were allowed to go out so that they wouldn't intermingle. So they're starting on Saturday afternoon, and one family will go through the street first and then the next family. They're very much creative ideas, which I absolutely love. But one-to-one, when I'm working with somebody, I actually ask them to create a list. Create a list of all the things you wish you could do and learn. What books do you want to read? And start checking off those achievements. For my family, we were doing a lot of growing and gardening outside, and we have now started looking up ways on how we can bring that into our home for the winter, for our mental health. So depending again, everybody's affected differently, and the interventions that are needed will be different depending on the severity of the need.
Absolutely, and I think these are some of the really good ideas which you shared with our viewers. Thank you, Lynne. Thank you so much for your time. In the end, any message for the community?
My last message, first of all, I want to thank you so much for having me on. And, I want to say hashtag we're in this together. And what we need to remember is that we are in this together. And there are people out there that care and want to connect with you. So if you can't find it within your own family, in your own community, reach out. We're here. We're waiting for you.
Absolutely. Thank you so much for joining PTC Punjabi once again, and please stay safe.
You too. And we'll talk soon. Take care.